Hello everyone, we will be presenting on a root cause analysis on improving low breast cancer screening rates. And these are our team who collaborated on our work. So breast cancer is the most common cancer and the second leading cause of cancer death affecting women. Regular mammography screening can help detect breast cancers early, leading to earlier interventions and improved outcomes. The National Healthy People 2030 sets a target screening rate of 80%, but there are significant health disparities in underserved populations in Hawaii, such as Native Hawaiians, Pacific Islanders, and Filipinas. In a large primary care practice in West Oahu, the baseline breast cancer screening rate in these communities was 59% as of May 1st, 2025, which is over a 20% gap from the national goal.
During this project, we worked with Dr. Aurora Mariani at her primary care practice located in West Oahu. Her practice largely serves patients of Filipino, Native Hawaiian, and Pacific Islander descent. For this QI project, we wanted to understand why there is such a big health disparity in breast cancer screening rates in these populations, identify primary root causes, and then develop solutions that target these root causes. To do this, we performed a chart review of 318 HMSA-insured patients at this clinic and compared the data to 2025 HMSA insurance claims. Patients were either included or excluded based on the criteria listed in HMSA's 2025 Provider Resource Guide. We also interviewed staff at the clinic and nearby imaging centers to gain a better understanding of their workflows.
This process map shows the steps a patient goes through to complete a mammogram and the workflow for the healthcare teams involved, from the time the patient makes an appointment with their PCP to completion of the mammogram and follow-up. Process maps provide a clear step-by-step understanding of how care is delivered and highlight areas where improvements can be made. This Ishikawa, or fishbone diagram, organizes potential causes of low breast cancer screening rates into four main categories: people, process or methods, environment, and materials or equipment. By breaking down the problem in this way, we can better identify where targeted interventions may improve screening rates.
This is a Pareto chart that indicates the top root causes of low breast cancer screening rates. For the 130 patients who are due for breast cancer screening, we'd like to bring your attention to the top three categories shown here on the left. These account for 80% of all patients overdue for a mammogram, which aligns with the Pareto principle, where 80% of the problems or failures can be attributed to 20% of the possible causes. Determining these root causes enables us to identify interventions that target them, making the most significant impact on screening rates. Our key takeaways are threefold. Firstly, access to mammograms in West Oahu is limited, with significant scheduling challenges. Second, the process of scheduling mammograms is difficult. And third, inaccurate breast cancer screening rates exist due to discrepancies between insurance claims data and electronic medical records.
Lastly, our next steps are to implement and test possible interventions which target the top three causes. These solutions include outreach to patients to remind and help them schedule their mammogram appointments, outreach to patients to schedule appointments with Dr. Mariani, and reconcile insurance data with electronic medical records data. We would like to thank Dr. Aurora Mariani, her staff, and Dr. Jimmy Chen.